situation, that means that BHX3 must be secreted by the cell and turn around and causes apoptosis and that cell. Okay, in this case, this is done by tunnel assays, and of course this is the background. And what we do is that we apply TGF-beta to the cells in culture. We notice that there is a level of apoptosis that is much higher than background. And of course, based on the pathway, the TGF-beta has induced the synthesis and release of BHX3 protein, which turns around and causes apoptosis of the cell. Okay, if this is indeed the case, then if you put a BHX3 antibody, you will be able to block the BHX3 effect that is subsequent to TGF-beta treatment. And indeed, we see a tremendous, large, significant drop of the number of cells that undergo apoptosis. And it depends on this TGF-beta 1 and TGF-beta 2. It is even more prominent in terms of the BHX3 antibody that blocks the BHX3 that's synthesized as a result of TGF-beta 2 treatment and come back and causes apoptosis of these cells. But we notice that both in HRP as well as the other cell. Now, what about, if you were to apply TGF-beta, okay? And what we did was that we used recombinant BHX3, and we added it to the cell culture of HRP or human parasites or endothelial cells, and we found that there's a dose-dependent increase in apoptosis. Okay, so clearly BHX3 protein will result in apoptosis of the cells. And if you notice that we use very high